Anderson. I'm from Sweden.
Hi, I'm Rotimi Amardian and I'm from Nigeria.
Hi, my name is Diana Alderbashi and I'm from Jordan.
Hi, my name is Sejong and I'm from Korea.
Hi, my name is Seoul Park and I'm from South Korea.
I think it's a big issue that it's not available for everyone. Back home, it's free healthcare for everyone who lives in the country, and I think that's really good.
Well, I've been to the hospital here once, and it was quite a good experience. It was the service was good. Like with talking with the doctor one was a good, positive experience, which is kind of pretty much like what I like would have gone through like back home, and also just other attendants, nurses, or like and people at the receptionist were much nicer than I'd have experienced back home, especially like in public hospitals back home. But the one thing I guess that I kind of found odd was the high price of healthcare here. I had like over $200 for a regular checkup, and it was. I was also shocked that wasn't covered by my health insurance, and I think it would cost a lot less if I were back home, like probably less than half of that.
Well, I think the healthcare system is not very efficient in the United States, and hopefully with the new act it will become more efficient. But as of for now, I think it's very expensive to get healthcare insurance. Now I'm covered with the university freshman insurance, and I know, for example, it doesn't cover my dental care expenses. So I try to take care of my teeth basically when I'm home in Jordan before coming to the United States, because my ticket home is actually less expensive than doing 2 or 3 teeth in the United States.
My personal opinion on the U.S. healthcare system. When I lived in Asia, I heard a lot of problems about the U.S. Healthcare system, and I understand that U.S. has tried to compare its healthcare system with other countries to see how it could improve it. And I think one of the biggest problem with the U.S. healthcare system is definitely the price. If you look at any other parts of the world, like for example Asia, is definitely much cheaper. And if you look at European countries, especially in the north, Sweden, Norway, although they pay high taxes, for the healthcare system, it's pretty much all covered by the government. And I think especially for people outside of U.S. to come into U.S. for example for me, to study here without an insurance is definitely a very scary experience, I guess, because you know that if you let's say you have to go see a doctor, it's going to cost you a lot, and getting an insurance without family here is also a very difficult process. And I think in order for the U.S. Healthcare system to improve, I think they just gotta lower the prices, but I think they just have to learn from other countries, especially the European countries, because I think their healthcare system so far has been proven to be most effective.
So I think my perspective will be, I think the quality of the U.S. healthcare is really great, because I know a lot of doctors from South Korea or like China, they will just study abroad in the United States so that they can learn a better technologies or better skills. But the cost-wise, I knew it's going to be really expensive, because in South Korea or China, most of likely people are going to have a universal healthcare. But in the United States, I knew you have to pay for like insurance by yourself, and before coming to the United States, I think that's one of the concerns that I had. So, and I knew the medicine here is really expensive, so I actually brought my own medicines, which are a lot cheaper, but it's still like very effective. So I had my medicine in my room still.
So a big issue that I've seen here is that the care for teenage women back home is a lot better. We get contraception for free, and we get checkups for free up to 21. We also can take tests for free again up to year 21, which I think is really good. It increases women's health, and they are more willing to go get checkups because they don't have to pay for it. So our healthcare system is a lot different back home since we have pretty high taxes. We get healthcare for free. As long as you live in Sweden, you get healthcare for free. And I think that's really good. Even though we do pay higher taxes, we get a lot of benefits. And that doesn't mean you always go to the public hospitals. You can still choose to go to private doctors if you want to. And some people decide to do that, but it's always going to be available for you, whether you want to go to a private doctor or if you want to go to a public hospital.
Well, for my knowledge, I think the healthcare is divided between private insurances, and also we have some, the old people are covered by the government, but I don't think it covers everyone. So we still have people who do not have health insurance. However, it's much cheaper to get a surgery or to take care of your medical expenses than in the United States.
I think the one of the biggest problem with the U.S. healthcare system in terms of ethics is I don't think patients really have much time they spend with the doctor, and you really need. I think you personally need to have like a personal connection or with the doctor, because from patient's perspective, that really helps them, I guess, mentally. Or like, for example, when I was in Asia, when we have personal doctor, or whenever we just have to go visit any doctors, it's really they really sit down, spend their time and talk to you, and let you go through step by step of the procedure and what the consequence would be and such. But in the U.S., I think it's it's so packed everywhere. They don't spend much time with the patients individually. It's all about this person that has this problem and just give them this medicine, whatever. But they never really sit down and talk to the patient. That's what I feel like is the biggest problem.
What has your perspective been of healthcare here in the United States?
I think the first experience will be I have my student insurance, so I wanted to buy contact lenses in the United States. So I called the company and asking, hey, if the eye exam will be covering my student health insurance, and they told me it's not going to cover it. And I was trying to figure out what's going to be cheaper for me to. I was wondering if it's cheaper for me to do the eye exam and buy contact lenses in the United States or ship it from South Korea. So in South Korea, we don't pay for eye exams, so you can just get inside and then do eye exams without buying it. Actually, you don't need to buy glasses at all. You can just get it for free. But in the United States, you have to get the eye exam, and then in order to buy the glasses or contact lenses, you have to have the prescriptions. So for me, I ended up choosing shipping from South Korea because it was a lot cheaper for me, even though I need to pay for international shipping. And I think second experience will be, I am in Global Health SSRI right now, and we went to Grundy in West Virginia, and I met a lot of patients. So we went to like a, how do I put it? It's called Remote Area Medical. It's a kind of organization that provides health health checkups for the patient who are on insurance or under insurance. And I realized that in the United States there are so many people who are actually uninsured, and to me it's more like unbelievable, and it's somewhat unethical in the sense that people should have healthcare for free, or like their socioeconomic background should not be the barrier to get the access to the healthcare system. So that was a huge shock to me, and the fact that the United States is like still number one, like superpower in the world, but cannot provide a universal healthcare to its people, I think that was like really shocking, and I think that's something the United States should improve, I think. And I also watched a very liberal documentary by Michael Moore, which is titled Sicko, and actually show a hospital dumping a patient out of the hospital only because that patient cannot afford it and he does not have insurance. And that's like something definitely immoral, and because you cannot really not cure the person, and you cannot let the person die only because person cannot afford it. And in that sense, I feel like, well, half of the nations have to die because this is the kind of same things. We are providing the foreign aid to like so many countries. Why are we doing this? It's because it's ethical. It's like the world that we live in together. So in that sense, you have to provide healthcare to your own people, because you cannot really help someone else outside while you're letting people in your country to die. Because of, like, maybe dying is like really, that's like really extreme word that I'm putting, but I feel like that's something immoral to me, that you're dumping your patient, you're letting them to die, and you cannot just say, yeah, you deal with this, because you don't have money. Like, that's something really immoral and needs reforms.
As you can see, international students have different perceptions of our healthcare system. However, they all seem to agree that it is too expensive. Why is it that in their countries, the healthcare is not only cheaper, but still manages to offer quality care? The bottom line is that no one should go bankrupt or be burdened by bills or insurance premiums. Healthcare is a human right, and we should strive not for quantity, but quality.